A 65-year-old male patient, Mr. Brown, walks into the emergency unit unaccompanied. He is short of breath, his lips and the tips of his fingers are blue in color, and he is coughing quite a lot. He went from one cubicle to the next, looking for a doctor or nurse who can urgently assist him. In his breathing, one could hear the wheezes in his chest, and the hunger for air was quite evident. What could this be? Hi, you are watching ED Files, and I am Dr. Thabo Mafa. Cigarette smoking is one of the major contributing factors to lifestyle-related illnesses. Amongst other things, it can cause cancers, abnormal vessels, and also chronic respiratory diseases. Majority of chain smokers end up with a condition called COPD. And what is it? COPD is a progressive respiratory disease that includes conditions such as chronic bronchitis and also emphysema. It is often associated with cigarette smoking. Let us now talk about etiology, or how COPD comes about. There are several factors that can contribute to this condition. The primary one being tobacco smoking, which accounts for about 70% of all COPD cases. And other factors can be air pollution, such as people who work or live in industrial areas. And sometimes genetic factors can play a role. In some cases, you can have occupational hazards, like people who work as firefighters are more likely to have COPD. Let us now talk about the pathophysiology, or the events that take place in a patient with COPD. Remember that COPD is a chronic obstructive pulmonary disease. So you could have a patient with bronchitis, and this we call them blue bloaters. They often have excessive mucus production in their airway, and there is inflammation and obstruction of their airways. They are prone to infections, and in most cases, they are short of air, and they may present with cyanosis, which is blue discoloration of, could be the lips or the tips of your fingers or the toes. And they often have right heart failure. And again, on the pathophysiology, let us touch on the second condition, and that is emphysema. These we call them pink puffers. The events that take place in this case is there is destruction of the alveolar walls. So an alveolar is a small sac in your lung tissue that helps with gas exchange. And because there is destruction of the walls of this alveolar, there would be impairment of gaseous exchange. There would be air trapping or even hyperinflation of the chest. The chest in most cases is barrel-shaped to indicate that there is a lot of air trapped within the chest cavity. And these patients may compensate with what we mention as pursed lip breathing to help with maintenance of oxygen levels. And pursed lip breathing can be described as someone who's short of breath and they would try to limit air that is going out, and it would be more like to try and help or to maintain the air, an open airway, and also to keep the alveolar open to enhance oxygenation or even gas exchange. Mr. Brown presented with the following symptoms. Remember, he's got COPD, chronic obstructive pulmonary disease, and these were the symptoms. He had progressive shortness of breath, and he was intolerant to exercise. For him to walk from one cubicle to the next looking for the nearest doctor or the nurse, it was quite an effort for him. He had productive cough, and it looked like he had lost a lot of weight. And also, in some patients, they may present with recurrent chest infections. So when you examine a patient with COPD, what are the possible findings you could have? And these are the signs. In a case of chronic bronchitis, a patient tends to be more obese in most cases, and they are cyanotic. Remember, we spoke about the blue lips and also the blue color on the tips of the fingers or even the toes. They can have swollen extremities, which we refer to as edema, and they can also have a chest that is wheezing quite a lot. However, in the case of emphysema, these patients have got hyperinflation of the chest. The chest would look barrel-shaped, and they compensate by using pursed lip breathing. That helps them to maintain the oxygen levels in their body. So in the case of Mr. Brown, we want to confirm if this is COPD or not. What investigations have we done? We've done a lung function test, which was less than 70% of the expected. And this would confirm that there is obstruction in the airway. We've done some bloods. We've done a blood gas. This had shown us that his carbon dioxide levels were quite high. We've done a full blood count to check for infection markers. We looked at the renal function test and the inflammation markers, amongst other things. And these patients tend to have what we call polycythemia, meaning that there is accumulation of red blood cells. Remember, these patients don't have adequate oxygenation. So this is what happens. Your body starts to compensate by producing more red blood cells to try and have as much oxygen as possible. And also you can also do chest x-rays and CT scan of the chest to exclude conditions such as lung infection and also a collapsed lung. And probably you are now asking yourself, what was the outcome for Mr. Brown? He was a heavy smoker, and I would refer him as a chain smoker. On a daily basis, without fail, he smoked about 20 to 25 cigarettes a day for a period of 30 years. This resulted in COPD, which at this point in time has compromised the quality of his health significantly. In the emergency unit, we had to intubate him as he showed signs of impending respiratory failure. He was taken to ICU where he was managed, but his prognosis at this point in time is still questionable. And in conclusion, COPD to a large extent is caused by tobacco smoking, which in simple terms we call it cigarette smoking, amongst other factors. It is therefore advisable to smoke responsibly. Early recognition of the symptoms and signs of COPD, chronic obstructive pulmonary disease, and also commencement of treatment as soon as possible can save a patient's life. And thank you for watching.